Hi, everyone. Welcome to the podcast, The Reality of Plastic Surgery. I am Dr. Aftab Siddiqui. I'm a consultant plastic surgeon in Manchester. I'm the host of the show. I started the podcast because I have been working in plastic surgery for a long time, and I wanted to bring a lot of useful information to my patients and the audience, and how these important informations can help you shape what plastic surgery you are looking for, and how to get in-depth information about the real issues before making a plan for plastic surgery. In this video, I will be talking about a plastic surgery consultation. If you are considering any plastic surgery and you are planning to see a surgeon for a consultation, you should be doing some homework. So a consultation planning should be few things you need to do before the consultation, few things you need to know you will be doing during the consultations, and few things you have to keep in mind to do after the consultation. So what are the things you should do when you are planning a consultation? You should start looking for a surgeon. You should start the search by going on the GMC website. Look for their registrations, their credentials. Go on the surgeon's website, read about the surgeon, his training, his qualifications, his experience, and that will give you a good idea about the surgeon. Then you should read about patients' reviews. Go on independent review websites. Go and read about the patient's experiences of the treatment provided. Once you have shortlisted one or a few surgeons, then you can consider making an appointment with the surgeon. So what are the things you should expect during the consultation? So when you see a plastic surgeon, you should expect that he will be taking a very detailed history. He should engage, he should listen to you, and he should make a note of all what you want and what you are looking from the treatment. After the history part, there should be a detailed examination. The surgeon should examine. He should take some measurements which is needed for the treatment. After these, the surgeon should try to assess and discuss with you what your goals are from the treatment. So he should offer you what treatments you will benefit from. So you should be given all the information regarding the treatment. Then the surgeon should explain the details of the procedures. So he will explain whether it is a local anesthetic or a general anesthetic, what is the duration of the surgery, and is it a day case? Do you need to be staying overnight? So all these things he will go through. The surgeon will also go through any of your current medications and what medications you will be going home with. He will discuss any supplements you are taking, and he will explain the side effects and risks if somebody is smoking, and what are the issues with drinking alcohol. After going through these details, you would expect that you should be given some idea about wound healing, what will be the downtime, when you will be able to start doing normal activities, when you can start your exercise, when can you start driving, when can you return to work. So your surgeon will go through all these issues. After this, you should know all the risks and complications associated with the surgery. So the surgeon will provide you information about all the risks, and he will go into detail of all the important risks and complications. This should cover a detailed consultation, and a good plastic surgery consultation should last anywhere from 30 to 45 minutes, depending upon the complexity of the case. So coming to the third stage, what are the things you should be doing after the consultation? So after the consultation, you should expect to get some leaflets on the procedures you have discussed with the surgeon. So when you go home, read all the leaflets, go through all the important issues, make a list of questions you want to ask based on your study of the leaflets. Generally, a surgeon will give you a cooling off period. So you can make another appointment for a second consultation to go through your queries and all the details of risks and complications. You should know that any consultation is not binding to go ahead with the treatment. This is absolutely voluntary, and you don't need to feel pressurized that you need to go ahead. So it's a purely a voluntary decision.